This is Pam. Today, the topic is parasites cause lesions in the central nervous system. And this topic is very important because this is how we diagnose multiple sclerosis, but other conditions like migraines and other neurological diseases. And so it's very important, especially like if we're talking about MS, to understand that in order to get an MS diagnosis, they are looking for lesions that will appear in different parts of our central nervous system over a period of time. And the actual panel of people that have decided how we diagnose multiple sclerosis, and this could be true for other conditions too, but for in the MS world, the panel that has set the guidelines for the diagnosis and basically the treatment of MS, they're basically saying that there's no value in looking at the spinal fluid for any type of infections or parasites. There's no value there. We're just concerned about lesions where they are present, and basically we have to find lesions that occur in different parts of the central nervous system over a certain time frame. But yet, the scientific research shows that it's just commonly understood that when parasites are present in the central nervous system, they show up as lesions. So we're going to talk about that today because that's really, really important. Are you guys tired of not knowing what's causing your horrible symptoms, whether it's migraines or whether you have a horrible diagnosis of multiple sclerosis? And so it is very important that we understand what's causing the lesions. And hopefully, in time, we're going to get our standard of care to start to shift their focus instead of only being concerned with, oh, you have lesions and you must have MS, so we're going to use these drugs to try to manage the lesions. It's like, no. What is causing the lesions? Let's treat the cause. Let's resolve the lesions, and then get on with our life and not live with chronic disease. So if you haven't met me before, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And I love talking about this and creating awareness and helping people to see that maybe you're suffering with horrible, horrible symptoms. Maybe you've had an awful diagnosis. But what we're seeing, and I shared last week again with like even just autoimmune disease, is that some of these wonderful hero doctors, I call them, they're like, you cannot have autoimmune disease without some type of infection or parasite because our immune system is intelligent and it does not attack itself. It's not stupid. So now we're going to look at the lesions that are present in multiple sclerosis, but not just MS, all kinds of other conditions. And I'll talk about some of them in a few minutes. So what I'd like you to do is go ahead and share your questions, your comments, maybe some ahas that you get from this. So with multiple sclerosis, we use MRI, which is the magnetic resonance imaging. And that basically is a machine. It's a very, very strong magnet or magnets that take pictures of our brain and our spinal cord, and it can go deep into the tissue. They're looking for things that are abnormal. So they're looking for lesions. And in the standard of care world, they don't know what's causing the lesions. They know that the lesions are pockets of inflammation, but they don't know what's causing it, right? As long as we don't know the cause, then, it's pretty hard to find the cure. So in multiple sclerosis, it is a demyelinating disease. And so what happens is there is something, and they're telling us that it's our immune system that's going after our nerve cells. And our immune system is attacking our nerve cells and causing inflammation and causing damage to the myelin. And many of you know this. And not just the myelin that surrounds the fatty tissue that surrounds the axon that allows the signals to go really quickly, messages from our brain to our body, etc., but also the damages to the nerve cells themselves. So that's what they're saying, is that with MS, your immune system is attacking your nerve cells, the myelin, and that's causing damage. And so what they want to do is they say, okay, the lesions are pockets of inflammation. It's just your immune system is attacking your body. And so we really just want to try to manage those lesions. So MRI, like it's kind of like they've got this neatly packaged system of diagnosing and treating MS. And the MRI is not the only thing they use. They will use that you'll go into the office of the doctor and they will get your health history and they'll do some tests like looking at your reflexes and other things. And so the combination of that, the clinical office visit plus the MRI, those are usually the main ways that they are diagnosing multiple sclerosis. So I'm going to talk a little bit more about MS, but honestly, this relates to many, many different conditions. It's just shocking because like we just have this system for MS, but it's the same with all the other conditions too, right? So disease modifying drugs are used to suppress the immune system, and they're hoping that that will manage the MS symptoms. So, lesions, or sometimes they call them plaques, they're found in the brain, the spinal cord, and also we can have them in the optic nerve. And so, this is again areas of damaged myelin and axons. So, the axon is the long part of the nerve fiber, the nerve cell, and it's covered with this fatty tissue, which is myelin. And so they're saying that the immune system is attacking the myelin. And then if it's in the inflammation stage, we could have healing, but if it stays if it ends up in the scarring stage where there's scar tissue, then it is not going to regenerate itself and will have damage, and then we will not have proper nerve function, which is awful. And that's why we really do want to get to the cause of it, because we don't want permanent damage to our nerves. And if there's some way that we can correct it when we're in the inflammatory state and let it heal, then we end up not having the long-term neurological damage. So in time, if we don't deal with the cause, these areas of inflammation where our nerves are being damaged, then scar tissue can set in, and we don't know how to reverse that at this time. So these lesions, they cause the nerve impulses that run along the nerve cell to really slow down, and that's where we end up with the neurological symptoms. But I do want to interject here is that what we've seen with our students is that although we have a lot of, and this is for any kind of chronic disease, you might have a lot of neurological symptoms. Yes, some of them could be stemming from damaged nerves in your central nervous system, but the inflammation in the gut really causes a lot of neurological symptoms also. So sometimes people can become, what we've experienced is people can become completely symptom-free just by treating the gut. They still might have the lesions. We'll talk more about the relevance of that, but they are symptom-free. So the problem is that, with using the MRI, it's all fine and dandy to look for lesions and to say, yes, we shouldn't have lesions in our central nervous system. But these lesions, they come and they go. They can increase in number. They can decrease. Sometimes people can be, in the early stages, they may not have lesions on their MRI before they're diagnosed with MS. So it's not an exact science, is what I'm trying to say. And you'll see that as we go through this. And so lesions will show up on an MRI as like a white spot. And there's specific places where it's not always the case, but if you have lesions in certain parts of your central nervous system, you could potentially have certain symptoms. So for example, if you have the lesions around your optic nerve, then that is, your vision is going to be impacted and you can have pain. So that was my first symptom, is I had really awful optic neuritis, like a severe case where I actually ended up with long-term damage to the optic nerve. Again, if I would have known back then what I know now, things would have been very different for me. But you can have a lot of headaches and pain, and then sometimes your vision will come back completely, but sometimes you won't. For me, the left eye was a complete blackout for 6 weeks, and then my vision came back, but the center of the vision is still dark, and the outside of the vision is clear. And that's exactly what we don't want to happen for people. For MS, a lot of times we have these lesions in our white matter. So there's gray matter and there's white matter. I'm not going to go into the anatomy of the brain, and I'm not pretending to be an expert in this area. We're just going to do like an overview to get you thinking, to get you to start asking questions. So important. So a lot of the characteristic or lesions that they say are really specific to MS, they will occur in the white matter, but on both sides of the ventricles. So also there's just some specific areas where where you may notice them. So cortical lesions also, and that is on the surface of the brain. Those lesions would be linked more with people that are diagnosed or end up with progressive multiple sclerosis. So lesions in the base of the brain that can cause, kind of in the back, in the base of the brain, called the brain stem, that can cause double vision, spinning sensation, balance problems. But again, these lesions are pockets of inflammation where your immune system is fighting something. They say that your immune system is attacking your tissue, but that is not the case, because how could we recover from that then when we treat parasites? And that's exactly what we see. We can also have lesions in our spinal cord, and then we might have things like numbness, and we can have tingling and weakness in one or both legs. Lesions can increase or decrease in number and in size. They can remain stable over time. So it's really hard. Like, a lot of times we get a misdiagnosis. It could be that somebody has a lot of migraines. They could be misdiagnosed with MS or vice versa. And then also there's a big paradox with MR, MRIs. And with that, new lesions may also be clinically silent, which means that they don't cause a lot of or any physical symptoms. So you could have new lesions that don't cause any symptoms. And on MRI, you also may show a person that has many lesions and they may not have many symptoms. So they're doing their best to try to figure out, and again, it sometimes takes years to get a diagnosis for MS, and there are many misdiagnoses for multiple sclerosis. But basically, we have lesions in the central nervous system, and we have specific neurological symptoms. But there are so many lesions that they call them nonspecific, but like sometimes the nonspecific lesions are also present in MS brains and in their spinal fluid, not their spinal fluid, their brains and their spinal cord. So nonspecific lesions, they are often found in people that are over 50 years old. So you may not have a neurological disease, but you could start having these lesions showing up in your central nervous system. It's very, very common. The central nervous system is not a sterile environment. Microbes get into our central nervous system, and it's very well documented. It's so easy to find this information, and I'll share with you just some of the things I was doing just before this event. You could spend days and days and days looking at this. So we know that the central nervous system is not a sterile environment. Different types of parasites get into the central nervous system, and that's why we need our immune system in our central nervous system to protect us. We need our B cells and our T cells. We need our eosinophils. We need all kinds of specialized immune cells to defend us from these horrible parasites. That's their job. And so as we get older, and we live in countries where we really ignore parasites, so they're kind of getting out of hand. Like, they're just, if we would treat them early, if we would recognize and treat them early, if we would encourage people to, eat healthy, eat not too many processed carbs, to keep rebuilding the good microbes, keep bringing back the good and knock back the parasites occasionally, we could add many, many, many years of quality of life to our life. But we don't do that. That our healthcare system is really a sickness care at this point in many or all of the developed countries. So in the scientific literature, people that do not have multiple sclerosis or other diseases, if they're over 50, they likely have these lesions in their central nervous system. And yes, there can be different sizes of lesions. They can be located in different parts of the central nervous system, but that fluctuates even within multiple sclerosis. So the size, the numbers, whether they come and go, whether they stay, it is not an exact science. So also people that have migraines, very, very common that they have lesions. They might have most of their lesions in a different part of their central nervous system versus MS, but who cares? Like, what's causing the lesions? Who cares where they are? What are they? Why are they there? They should not be there. And if we could shift our science and our focus to that. So remember I said at the start, the panel that decides how we diagnose and how we treat MS, I said, no, we're not looking at the spinal fluid for parasites. No, there's no value in that. It's like, yeah, that's where the value is, because then we could treat, we could figure out, like, is it always one type of parasite that likes to live in a certain part of the central nervous system? Is it that, people with MS have maybe 3 or 4 or 2 or 4 different common parasites that are located in certain parts? Another fascinating thing is that with most of the lesions with multiple sclerosis, and I haven't had a chance to look at other diseases, but most of the lesions, they occur around a blood vessel, around a little blood vessel. So that's another big thing, because these parasites, they need to be fed right from the blood vessels where they're getting nutrients, etc. And again, these lesions can be present in people that have migraines, people that have radiologically isolated syndromes, that have uh, spondylopathy and peripheral neuropathy. And I don't know what NMO is, but transverse myelitis and lupus without myelitis, stiff person syndrome, anti-calcium channel antibody syndrome. Let's see, some myasthenia gravis, fibromyalgia, small vessel disease, Bell's palsy, infectious encephalomyelitis, mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes, copper deficiencies. So there's so many different conditions that have lesions in their central nervous system. So now we know that the standard way that we're diagnosing MS, the very, very big part of it is that you've got to have lesions in your central nervous system. If you don't, you're not going to get an MS diagnosis. And then they generally are found in certain parts of your central nervous system, the lesions are. But again, they come and they go, they decrease and increase in number. And some people might have, that's the whole thing with the paradox with the MRI. Sometimes people might have a lot of lesions and very few symptoms, and some people might have very few lesions and a lot of symptoms. So I personally feel that they're just using the MRI as, and this is my own personal humble opinion, and I'm not a neurologist, but I'm just with my observations, is that the MRI is being used to make sure that it works well to prescribe the MS disease modifying drugs. That's basically, it's a tool to help make sure those drugs are being used, as long as we don't know what causes the lesions, right? So let's look at some parasites that cause lesions, and there are so many parasites that cause lesions. I'm just going to go down here to my notes. So I just looked at one study, and the one study, they were looking at parasite-induced lesions that would affect the eye. So with parasites, they can directly result in lesions or indirectly. So sometimes it's their presence that the immune system is going after, and sometimes it could be toxins that they produce that would cause an immune response. So the parasites can directly or indirectly cause these types of lesions. And again, we're going to have different types of lesions depending on which parasite it is. So one study that I mentioned, they looked at parasite-induced lesions in the back part, the back segment of the eye. And they found that there were many different types of parasites that can cause lesions in the back part of the eye. And so, toxoplasmosis, some of you might know what that is, malaria. So, these are protists, these are single cell protists, Giardia, leishmaniasis, but also little roundworms like the microfilarial worms, one that would cause river blindness. And then we talked a couple of weeks ago about the immature tapeworm. So, the cysticercosis, or I should say neurocysticercosis or cysticercosi tapeworm larva. And so, and then also I'll speak in a minute about the flatworms, other flatworms too. So in the eye, they found many different types of protists can cause lesions in the back of the eye. Nematodes can, and then in the central nervous system. So then what you can do is you can take virtually any parasite that they're finding in the central nervous system, and you can say, let's say, toxoplasma and lesions in the brain. And you'll find studies for showing toxoplasma, which again is the very small protist, the single cell protist, and they cause lesions in the brain. Again, a lesion is literally a pocket of inflammation. I've always said it's like a pocket where your immune system is fighting infection. And then we talked about the neurocysticercosis, which is the immature tapeworm larval cysts. They can definitely cause lesions in the central nervous system. I've done some wonderful video and blog posts on that. You can find that on livediseasefree.com. Just a study, 1945. Why are some of the studies old? Because there's no money in treating parasites. They dropped that kind of research. So 1945 study, lesions in the brain associated with malaria. Borrelia also. So we talked about malaria, but Borrelia is the bacteria that causes Lyme disease. And Borrelia is known to cause lesions in the central nervous system. Then there is also the schistosoma. So these are the flatworms, the flukes that end up in the central nervous system and cause lesions. So cerebral lesions are primarily caused by schistosoma japonicum, and spinal cord lesions are due primarily to two different types of species. So this is schistosoma mansoni and schistosoma hematobium. Interesting words. Okay, so that shows you that there's different types of species of flukes, flatworms, that cause lesions in either the brain or in the spinal fluid. And then I was running out of time, but even E. coli, just type in E. coli and look and see if you can find, does E. coli cause lesions in the brain or in the central nervous system? And yes. So one study, we described a case of spontaneous E. coli meningitis with multiple enhancing brain lesions and liver abscesses. So how is this possible that it's so easy to find that virtually any parasite that will infect the central nervous system will cause a lesion, yet we don't know what causes lesions? We just assume that it's the immune system. We're assuming that it's our immune system that is attacking our own tissue. That is not even logical. That is not even scientific. Should we not exhaust that whole area? Should we not just dig and dig and dig and go through all of the different types of parasites and see if they are present in people that have multiple sclerosis or other chronic diseases? Absolutely. So I'm just wanting to just help you to start thinking outside the box. And it's so sad because this stuff is so common sense. You don't need a science degree. I do have a science degree, but you don't need one to just do some basic searches like toxoplasmosis or toxoplasma, brain lesions. Oh, there's studies where they have, and yes, I'm not saying that every brain lesion in MS is one type of parasite. No, I'm saying that we're diagnosing multiple sclerosis based on brain lesions. They're telling us they don't know what causes them. They're telling us we don't need to look at spinal fluid for for infections, even though we know that virtually any type of parasite can cause a lesion in the central nervous system. Why? That's the question, is why? Why are we not looking there? Why are we not exhausting that? I've shared some really great research from the University of Calgary. They're looking at the gut microbiome, and they're looking at bacteria and viruses and looking for different species. And yes, as I mentioned, that we're noticing that we have a lot of bigger parasites in the gut, and as we treat them, sometimes we can become symptom-free, but that means maybe we still have some of the lesions and maybe we need to treat more. But why? When they're doing a spinal tap, why wouldn't they take some of the spinal fluid and start to examine it for different types of parasites when we know scientifically that virtually any kind of small parasite in the central nervous system will result in a lesion because your immune system is fighting that area where those parasites are present. And they're different shapes. Some are round, some are the lesions, some are round, some are oval, some are like crescent or moon shaped. Some of them have little fingers. So there's so much variability to the shape of the different lesions, to where they're located in the central nervous system. And again, there's so many other diseases. Like I didn't know that migraines, that they usually, if you have a history of migraines, that you probably have lesions. I didn't know that people over 50 have lesions. It makes sense though, right? The longer we live on planet Earth, these microbes just start to take over, and they move from, our gut, they move into our blood, they move into our organs, they move into the central nervous system. But we don't want to suppress our natural defense then. We want to protect our immune system that is defending us from these infections, and we want to target the parasites. So let me know what you think of all of this. It's just really, really fascinating. Hello. Hi. Elvia, hello. You do believe as parasites? Absolutely. And remember that a parasite is any microbe that lives in you and causes you harm. So it could be bacteria, it could be a protist, which is a single cell, is a little bit more specialized. It has more different organelles and structure than, let's say, a bacteria, more complex in its physiology. But then there's also different types of worms, the small filarial worms. They can cause lesions in the central nervous system. Then also the tapeworm larval cysts can cause lesions, right? So, and then I'm sure that I have looked, I don't have it here, but I was like going down bunny trails and rabbit holes. But I'm sure if you did candida or mold, I know that they can live intracellular, but I would not be surprised. And I do know that different types of fungi are also in the central nervous system of MS patients, and everyone I work with that has chronic disease, they all have some type of fungal issues. And so could they also be causing lesions? I haven't had a chance to look. You guys can look that up if you like. But I wouldn't be surprised, because the lesions are really, I think your body is trying to contain the infection and it's trying to deal with it, just like a cyst would be in a different part of the body. I'm so happy that this is making sense to you. Area. Yes, it is recorded. Actually, this is live right now. We're live right now. And Tasia, beautiful names, really unique names. Recent research is lying about Epstein-Barr virus as the cause of MS. I've done a video on that. So at the beginning, I think of 2021, there was a study that came out, and they were really promoting that MS is caused by the Epstein-Barr virus. Of course, they want to make vaccines for that, right? And so I dissected that study. It's a very poorly done study. So they start with this huge number of people, but then like thousands. And then they end up, the ones that they're actually studying in that group is like 35 people. It's like so small. And with Epstein-Barr virus, I'm not saying viruses could never affect our immune function. They probably can. But if over like 95% of the population tests positive for Epstein-Barr virus, then how can we say that it causes MS? Then wouldn't we have a lot more MS cases if basically everyone is testing positive for Epstein-Barr? I would think so. So nothing has come from the viruses yet. And as far as research and help, et cetera, or causing disease, I think that whatever viruses are, and like after we've gone through this last virus for the last couple of years, and there's just been so much misinformation out there. And I studied it in university too, and I'm really starting to question a lot of things. I'm not saying they're not real, but what we see in our students is that if you treat the largest parasites, the ones that are the biggest, that are causing the most symptoms, then your immune system is going to deal with the smaller ones. It's going to be working a lot more effectively and efficiently. And so that's important to know. So we don't really focus on the viruses, we focus on treating the larger parasites. But there are certain natural things you can use to help to offset the viruses if you want. But focusing on the smallest parasites is not going to get you the results that you want because they're not causing most of the grief that we're dealing with. Hi, Aurora. And hi, Dick. Your wife has PLS. So, Dick, I have had a student, I haven't worked with a lot of students that have PLS, just a few PLS and ALS, but one of our students, Lisa, and I have her testimony, I think it's on YouTube, on our website, possibly to Live Disease Free, but YouTube, you can check it there. And she was diagnosed with PLS, and by treating parasites really well, she has improved 70%, according to her, as far as her mobility and all kinds of other. Can't remember if she had bladder issues, but usually there's a lot of different neurological symptoms. She's working out, she's retired, she's playing with her grandkids. She is doing really well. Could she treat even more? I think so, but 70% improvement for an incurable disease is pretty nice. So yes, this all relates to, it doesn't matter what type of disease you're dealing with, or it's all chronic infections, chronic parasitic infections. Anna, you have this certain type of parasite treatment. So we don't recommend just taking a parasite treatment. What if you don't have roundworms, right? And so like, for example, with multiple sclerosis, there is a study, and I've talked about the study where they found that it was very slightly helpful for people with MS, but it, again, like, what dosage did they use? And we have found, because we use, like, if one of our students that we're working with, if they test well for that specific parasite drug, then they will take a much higher dose, and they're using it in combination with other parasite drugs. We have not found one magic parasite drug that gets rid of all the parasites. There are different parasite drugs that will treat roundworms, and different parasite drugs that will treat tapeworms and flukes, and then also different ones that'll treat, like the protists, the small parasites that cause diarrhea and malaria and babesia and giardia, all of those ones. So you really have to use the treatments for the parasites that you have, and we have very poor testing. And I talk about that on other videos. Basically, we use energy testing so that we can see which of the parasite treatments work the best for us versus what parasites we have, because we're not able to use good stool tests at this time. And David, what parasite can show up with the 2T on the MRI? So it can be anything, honestly, because with the different types of, whether they're using the dye or they're not using the dye, so some of the lesions can be more active and some of them are less active. I think it has to do with how active the infection is. And I don't know which specific parasites are going to cause which specific lesions. We do know commonly which treatments seem to be most helpful for MS, but it's not a cookie cutter thing. That's why we like to be energy tested anyhow. But it's kind of like if your immune system is fighting really hard, then a lesion is going to show up as it's more active, and that's when we have more flares. But keep in mind too that a lot can be happening in the gut, right? So there can be some people that have more lesions, but they don't have any more symptoms. There could be people that have, very few lesions and they have lots of symptoms because the symptoms are coming from their gut, from the parasites in their gut. There is this nerve highway between so the nerve nerves in your digestive tract, many of them connecting to your brain. And so whatever inflammation is happening in your intestines really impacts us neurologically also. So it's not just the lesions, but I'm just trying to tell you that what we use to diagnose multiple sclerosis, we're saying if you don't have lesions, you don't have MS. If you have lesions, you do have MS, with their other clinical observations, obviously. But so that is really important because it's like, well, what are the lesions? We don't care if we have 5 or 10 lesions. We want to know what they are. We want to treat them. We want to get on with our life. We don't want to live with disease. Really important. That is the whole premise. So I really hope you guys help start talking in different groups, start, be the foot soldiers to bring this information out. So I will be putting an edited version of this video with my notes on a blog post, which we do every week on our website, livediseasefree.com. And so you can go there by Friday, or you can actually go to our website and opt in so that we have your name and email address. That way, every week you'll know when our newsletter comes out, and then you'll always receive that. And so some people like to read, just having it concisely, or some people like to watch a video, but it'll be in video and written format. And I really hope that you share that with other groups and share that with doctors and share that with, integrated practitioners and different. And again, it's not just MS. So Anna, you've been taking diatomaceous earth, zeolite, activated charcoal, and a certain medication for treating parasites, colloidal silver, tons of herbs and vitamins. You have 30 lesions. And you've had MS for 30 years. You work full-time at a hospital until mandated they kicked you out. So just so you know that the parasite treatment that you're using does not cross the blood-brain barrier. So if you do have parasites, the lesions are caused by parasites, and whatever's in your central nervous system, that treatment is not going to cross the blood-brain barrier, just so you know that. So it's not going to treat there. And neither will diatomaceous earth. There's some of these things are okay to use, but you have to understand what they'll do for you and what they won't do for you. And that's what we can help you with in the Live Disease-Free plan. So if you are looking for a proven plan where people are using things, in the right order, and they have some strategy and planning, and it's a proven plan, it works. So for example, we would not recommend the use of a lot of colloidal silver, because even the best colloidal silvers, in time they build up in you, and if you use too much of it over years, your skin can turn gray. And it's kind of like, is it really necessary? Is it going to really make a difference with what you're dealing with? And we have found no. Maybe if somebody had GERD, like where they have inflammation in the esophagus, and they're doing all kinds of other things to, bring that stomach acid back up and bring the inflammation down, and they use something short term like colloidal silver and others to help decrease inflammation so they can swallow. Again, that's short term, using it for a purpose, localized inflammation, supporting that. But when you're diagnosed with MS and you're just taking all these things and you're not getting better, look at the Live Disease-Free plan and see if that's a good fit for you, because it's very, there's a reason why we do everything. And there's a lot of things that we would say, I wouldn't bother with that. I wouldn't bother with that. That's not really going to make a big enough difference. And that really adds up for people, right? There's certain things like diatomaceous earth is not expensive, but if you're taking 15 supplements, that is expensive. And are they helping you? Are they feeding the parasites? Are they really making a difference? And I hope and pray that this goes mainstream eventually. I really hope and pray that the doctors will take this over and will like, when people start to get the neurological symptoms, if they want to do an MRI, that's fine. But it's like, okay, you've got lesions. We know that's inflammation. We know your immune system is fighting some type of infection. Let's go to work to figure out what kind of infection it is, right? And we don't have to look at the spinal fluid to do a spinal tap. That's very invasive. It very often can just be a lot of symptoms, health history, but start looking in that area of what it really is, and it is parasites. Lesions are caused by parasites. Your immune system fighting parasites. So lesions are little pockets of inflammation, the war, where your immune system is fighting parasites. And I'm really sorry to hear that, Anna, but you're the only one who can change it. So if you go down a different path, I wouldn't just be throwing mud against the wall, because it's a waste of money and a waste of time. And let's see here. Allison, hello. And has anybody used Purge Parasites here and felt better? I think that's what it's called, is Purge Parasites. That is a blend of herbs. You can take it and you'll probably pass worms. Some of our students have, but if you're a healthy person and you just want to pass some worms, you probably will with blends. So there's lots of different blends of herbs in the health food store. So there's usually they contain things like wormwood, cloves, and black walnut. But what we have found is that those blends, they're not enough if you have any kind of like chronic disease diagnoses like MS, ALS, PLS, Parkinson's, autoimmune disease. It won't get rid of the disease. You might pass worms, you might feel a little better, but the herbs are not going to be strong enough to treat the larger parasites. They're not going to be strong enough to treat the parasites in your central nervous system or the ones that get into the organs. But we can use them in conjunction with the rest. I haven't looked, Aurora, if Parkinson's also involves lesions, but I'm sure that it does. I'm sure that I did hear that. I'm researching so much, but that is something that you can easily just even Google search, like do Parkinson's lesions in the central nervous system. And I'm sure that it does. I'm absolutely sure that it does. Again, they call it sometimes plaque, sometimes they call it lesions. So Mariah, I got COVID, and then I was exposed to mold and came back with an MS diagnosis all before this. The dog had hookworm infection. I'm so sorry that we treated, and you feel that that was part of this. So there's a few things going on for you there. So number one, make sure that you don't have long COVID. You would want to definitely support yourself to get through that. That's what we help our students do. And then it's likely that the mold has kind of brought things to a head and your dog having hookworm, I'm assuming that you probably had pets for years before. But for most of our students, if they have an MS diagnosis or diagnosis of other autoimmune disease, that they were out of balance for years. It might have very often been before the age of 10 that they can look back on their life. And we do that in the program. We kind of look back and say, okay, like, how did I get to this place? What happened in my life to bring me to this place? And so you can go back, way, way back. And it's usually an overuse of antibiotics, sometimes early as a child. And then for myself, also tetracycline for acne. And that really puts us out of balance. And then we're susceptible to whatever parasites are in our environment. And then, yes, it just adds and builds, and pregnancies and our lifestyle, eating too many processed carbs, high stress, not enough sleep, all of these factors, and then getting things like COVID definitely can really set you back, but you can totally recover from that also. Hi, Maggie. So both your partner and you were diagnosed with pernicious anemia after 5 experimental vaccines. You were misdiagnosed for over a decade. I'm so sorry. He was so sick and in so much pain. I'm so sorry to hear that. Vaccines destroyed the innate immune system. And yes, I mean, there could be, especially some of us might be vaccine injured. And I shouldn't talk like that. I'm probably going to get into trouble. But like if you follow some of the really wonderful hero doctors, they talk about retroviruses. So like sometimes those things are infected or contaminated with viruses, and then that could become a problem. But what we have found, though, is that we focus on what we can change. And yes, there are certain things we can do to definitely decrease the activity of viruses, et cetera. But we have honestly found that the biggest cause of our symptoms are the bigger parasites. And I've seen this so many times in my students. It's like, it's just life changing sometimes when they pass these 2-foot worms. And you're just like, well, of course, or the intestinal flukes, right? And so even if we have the lesions, we definitely are concerned about that. We know it's pockets of infection. We know that it's gotten into the central nervous system, but focus on what you can. And some of the treatments will cross the blood brain barrier, but the biggest base camp of the problem of the parasites is in your digestive tract. That is the biggest part of the problem. And if you really, and it's challenging to turn that around because the surface area of your digestive tract is at least the size of a double tennis court. And so you can just imagine how many little worms can be and how many protists and bad bacteria and other things can be harboring themselves. And then we have biofilms and we have eggs and we have larvae. So focus on what you can. And what we have found is the more you decrease the burden in the gut, then the immune system really starts to help more and to work more efficiently, effectively at defending us also. I'm really, really sorry to hear what you went through, Maggie. But you know what? You can totally turn all of that around. So for us, our bodies produced antibodies to intrinsic factor. They messed up with our genes. But I believe in my heart, because I've worked with so many people that are so sick with incurable conditions, that your body is a miracle and it can rejuvenate itself if you give it the right support. And so heavy metals play a role in the high number of parasites. Is metal detox advisable? So our students won't do heavy metal detox until later. So they first support the body, they follow the diet, support the body, they're feeling a lot better. And then they will start treating, like they'll first get energy tested to see what they test well for. And then after that, they will start to treat. They'll do a couple, 3 treatment cycles. And once they're feeling stronger, yes, they will do heavy metal detoxes. Absolutely. Most of us, I think probably everyone has too many metals in them these days. We're getting them in our air, in our water, all over. So, Maurice, are meds helpful for MS? It depends what kind. So if you're using a disease modifying drug, the MS immunosuppressive drugs, you tell me, do you think you need your B cells and your T cells to protect you from different types of infections that can kill us? Yes, we do. So I am not an advocate. Again, I'm not a doctor. I can't give medical advice, but I personally, it does not make sense to me to take a drug that suppresses my immune system. Like Dr. Alan McDonald said, your immune system is not stupid. It is very often, I shared last week, it is the intracellular parasites that your immune system is trying to go after sick cells. And when it does that, it might look like it's some kind of autoimmune disease, but it's not. So we don't want immunosuppressive drugs. We want to figure out which are the parasites and treat them well enough and bring back the good microbes. So, Allison, you said great question on heavy metals. You've been exposed from fillings. I was too. I used to play with mercury as a child. We had some in a little jar and I used to play with it. Definitely didn't help matters. And then seems like physicians would have to try several parasite medications to know which ones that work. No, actually, it's not that hard. Um, It is a little bit of trial and error, but the energy testing has been really helpful. And the nice thing is, like with the parasite drugs, there are 2 or 3 that are commonly prescribed for roundworms, and then there's 2 or 3 that are commonly prescribed for tapeworms, and a couple 3 for different protists. So it doesn't take like if one parasite drug will treat different types of species of tapeworms or different types of, I call them cousins or species of flukes, or different types of roundworms. But again, the drugs we're taking too, they're not super strong. And so this is where maybe in time doctors are going to be using higher doses. Our students are just using safe doses, but there is a synergistic effect sometimes if you test well for 2 or 3 to take them at the same time, but you have to work with somebody, because if you don't know what you're doing, you're either not taking enough to make a difference, or you could take too much and you could make yourself very sick. So you do have to work with someone, but some of our students test well for 5 parasite drugs, and eventually they're taking all 5 together. I've taken all 5 of the ones that I test well for together. And then you notice, and then also that wasn't enough. We also use the oxidizing agent to get the to do enemas for the large intestine. So sometimes when you're taking the parasite drugs, it might not be enough to kill those bigger parasites that are in your digestive tract in the small intestine, but they don't like the parasite drugs and they're moving away from them, and they move into the large intestine, and then you can hit them with an enema with the oxidizing agent. And I do have a video on Rumble, how to treat parasites with oxygen therapy, or with different oxygen therapies, and one on how to do enemas to treat parasites. So it is a little bit of, and that this is where, Allison, if we could ever get, our whole research, all the scientists, if we can get them kind of in the right direction, where they're starting to, like, instead of just looking at the gut microbiome, they're actually looking to see what parasites could be in the central nervous system. If Dr. Alan McDonald found filarial worms and Borrelia, and he found the tapeworm larval cysts in the central nervous system of MS patients, he's willing to train other doctors to see this, to duplicate his work. But this all boils down to money. And so we have got to, maybe some of you are go-getters. We need to be getting different organizations besides the MS Society. We need to have organizations that actually take the money that people donate and put it towards finding a cure, not using disease maintenance drugs. And Aurora, your neurologist never mentioned lesions to you. Should you question him? You could always ask him, but he's not, I don't know that he's actually going to look into it much. I would assume they would know, but I can look into that for you too as I continue to research. But it's pretty easy. Just do Parkinson's, lesions in the brain, and see if anything shows up on Google. Helen, my doctor won't give me the antiparasites that I recommend. So this is where, if you don't have a practitioner that will help you and you need help finding the right help and accessing the treatments, that's what we help people do in the Live Disease-Free plan. So we teach you how to play an active role, and we support you through that whole process. So if you are, just watch my masterclass training, and I also teach you how to find practitioners. So it might be that your doctor won't help you, but you might have to look outside of that. And you might have to, number one, you have to convince them. You have to give them enough evidence to know that there's rationale for why you want to do this. There's a reason. And then also that the parasite drugs are very ineffective, or the parasite tests are very poor, and that it's safe, right? And with all of those things, and if your doctor is very caring, or if a doctor's caring, or maybe they're interested in treating parasites, then they will support you. But for a lot of our students all over the world, it's really hard to find practitioners. Hello, Mama Bear. Do you always see the parasites? I personally would not just take a parasite drug. If you're taking that one you're talking about, then that one, it can treat very, very small roundworms that you wouldn't necessarily see. And so like those roundworms, they could be in your eyes, they could be in your blood, they could be in your gut. And so they would treat those. A couple more questions here. You're so very welcome. So somebody's asking if that oxidizing agent crosses a blood-brain barrier, and as far as I know, that it does. So it's just oxygen, and it's bringing oxygen into your body, and as far as I know, that it really does cross the blood-brain barrier. But I don't know, again, by itself, if it's going to be strong enough especially if we're dealing with neurocysticercosis, where we have the tapeworm larval cysts in the central nervous system. So I'm going to let you guys go. We've gone just about an hour here. So if you are new to this, please watch the videos that I have on the different types of infections, the research. Start to build up your belief system so you really know that there is hope for you. You have to treat the cause. You can stop this disease, whatever you're dealing with. You can get your health and your life back, but you have to take a different path. And then if you need support, watch my masterclass training. And there you will learn how you can become a wellness champion, how you can treat these parasites. Actually, before I go, I do want to just share just a couple of things. Every week, it's like Christmas for me. We're supporting a lot of wellness champions right now. So we had quite a few successes come in yesterday, and I just wanted to really share really quickly. So one of the students shared, so she's just getting ready to treat, and she's noticed that, and most of the students I work with have MS, but other diseases too. She shared that her bloating is gone, that her gas is so much better. She's sleeping 7 to 8 hours per night, and she's only waking up to go to the bathroom later on in the morning instead of in the middle of the night. So these are symptoms, these are signs that the inflammation is decreasing, and they have to do that before they start treating. Another student that has multiple sclerosis, very disabled, she is sleeping at least 8 hours per night, so she's getting ready to treat also. Sleeping at least 8+ hours, 5 nights in a row, bowel movement every day, the diet as well, keeping the carbs low. And she said that she has noticed that, like just in getting ready to treat here, that she hasn't been able to sweat for years. And now all of a sudden she's able to start sweating again, which is amazing. Another student shared that, let me see here. Just trying to go quickly here. This one is really awesome. So another student that is, I think she's just starting to treat. She's had a really good week. And she's at the start, people are like, I just want to treat. I want to treat. So now she's slowed down, and she really did a good prep phase and had a lot of symptom improvements. And now she's starting to use that oxidizing agent, both orally and with enemas. And she's finding that it works really easily. She's sleeping really well. She said, I can stand a lot longer than I have been able to in a very long time, like for hours. I still have to lean against something, but I can stand and I love it. And I have a bit more feeling in my toes on my right foot, which is the foot that was affected by the MS. I've also noticed that I have these energy bursts around 7 to 8 o'clock at night. Most nights, I can almost walk without thinking about it. She said, which I find so interesting. And then she said, when I put my head down, looking at my toes, I get that electrical pulse down my spine. I still have this, but it has decreased in intensity. I think that's a very good thing. That's really exciting to me. And so she's just starting to treat. And then another lady who's quite disabled with MS, her husband shared some pictures, and her foot. A lot of times we have edema where we have really thickening ankles and feet swelling. And he just shared the pictures of how the inflammation has been decreasing in her ankle, then slowly going down in her midfoot, then decreasing in the MCP joints. He's a healthcare professional, so I don't know which one, but they're basically the foot bones that attach to the toes. Amazing. And then another student shared, I have to tell you that I'm so excited. I'm one of those that needed to lose weight, and I am starting to work out more now. So she's just getting ready to treat. She has not started treating yet. I've definitely lost weight. I can fit my old pants. My stomach pain is gone away for the most part, and the bloating has gone down. She still has a little bit of swelling at night, but not as bad. The swelling in my joints is less. So again, she's getting ready to treat. And I still need to lose more weight and more swelling, but what a difference. My skin looks better. And she had fungus in her toenails. I mentioned, remember, that a lot of our students have fungal overgrowth, and the issues on her elbows are gone. And she said, I am so excited about my future. I'm still in shock seeing my future of getting better instead of continuing to get worse. Hallelujah. Praise the Lord, she said. Awesome. And then another student who just started the prep phase, but then got sick with the virus, but her cognitive skills have continued to improve. She's noticing that she can handle and solve problems better on her own. And also her vision. She had double vision. So just from the diet, from the Live Disease-Free diet, all of this has happened. She hasn't done anything else yet. And so she said she can see things so much better on her computer, and she seems that the improvements are showing up all in her head. So her vision and her cognitive improvements all in her head. Another student, my symptoms have improved bladder control, less brain fog, and less weakness in my legs. So now she's getting ready to treat. So awesome. And then another student so we have a lot of students that are just kind of starting treatment or just about ready to treat. So this student is, she has just started to treat with the Parasite drugs. And she said, I'm feeling so much better. My walking is improving. I feel stronger and happier. I am now 200% sure that I'm on the right track and everything is going to be great and everything is working. And some of these students I'm working with are healthcare professionals, and I'm not a healthcare professional. So we're just using a proven step-by-step plan. And then another student who she's virtually symptom-free. She's treated the different types of bigger parasites, but she still had a little bit of a dull headache left. And so she is starting now to treat Lyme. And she said that I'm feeling so much better. My headaches have definitely improved. This Lyme treatment is really helping. But we wouldn't lead with treating Lyme because these larger worms can infect us with the Lyme. So we would just keep getting reinfected. And then this other person shared, just saw her neurologist, her specialist. There's no way that her neurologist is going to support her in discontinuing her medication, but she's going to talk with her pharmacist. This is her decision. I'm not telling her what to do. She's had so many symptom improvements. The last one this week, she shared, I'm feeling pretty good lately. The cool nerve sensation in my right thigh has dissipated. It was 5 out of 10, and now it's down to 2 out of 10. 2 out of 10. She has not started treating yet. She just started doing the enemas. She's just going to get energy tested. And then another student saying that by following the diet, her hair loss is no longer an issue, no longer losing hair. A lot of times that's the low thyroid. Definitely all connected to the parasites though. And she also has less inflammation in the tops of her eyes and also less rigidity in her neck. So those are just some of the amazing successes. And how many neurologists do you think that get those feedback reports every single week? You know, this is something that we have to brag about because it is unheard of in the standard way that we treat not just MS, but any type of chronic disease. They just manage people on medications and people just feel worse and worse over time. None of the disease-modifying drugs help us. They suppress our immune system and they make us weaker and they allow different infections to become a problem in time. So with that, I'm going to let you guys go. Make sure that if you need support, that you watch my masterclass training and then you'll fill out a form and then you can book a time to chat with me to make sure it's a good fit for you. Otherwise, have a wonderful week and we will talk to you soon. Take care and bye-bye for now.